I tell you what we're going to do. We're going to talk to the good doctor right now, Dr. Kevin Cavanaugh. He's a retired physician and founder and president of Health Watch USA. Good morning.
Good morning, sir.
How are you this morning?
Doing pretty good. Up early and ready to go.
Yeah. You sound like you're up and at 'em and ready. I understand there are testing shortages. Can you tell us about that?
Well, there are, and this is for two reasons. One is the healthcare system that we have, and the other is, of course, we have a raging epidemic down south. But some of it has to do that the tests that have been developed and how we do our testing is essentially taking a little packet that comes from a company, sticking it into their machine and running a test. And that machine is very much dependent upon the company for providing that little packet. The best example is if you bought a printer, you need to get the cartridge from the printing company. It's hard to get a cartridge from another company. And so that's put a real strain on the supply chain. If you don't have the exact ingredient, meaning that package, you're not going to be able to run the test. Some of the other countries have what's called a laboratory developed test, where the laboratory can actually run the PCR test and test it themselves and sort of develop it based upon a cookbook of instructions. And this was similar to the WHO test. But in the United States, we've lost a lot of that staffing and capability and depend upon these automated prepackaged tests. It's kind of like, as I said, getting a home-cooked meal versus having something like a TV dinner, very dependent upon the company. And so this is one of the complexities that we're facing with this epidemic.
You know, I was thinking about that, and I know of a lady who got a test over the weekend, and this is Wednesday, isn't it? Yeah, and still haven't gotten the results. With this testing that's taken so long in some cases to get results, she could possibly get a negative test result, but could be positive by now. Right?
Well, that's correct, because you can reacquire the virus, or as you know, the virus has a latency period to the time when it starts shedding, and then another period to when you develop the symptoms. So that is kind of frustrating. In some states, that wait time is 2 weeks, sometimes greater, which really completely eliminates the usefulness of the test.
I think it does too. Are there tests that are being tested, if you will, that maybe can give you like almost immediate results?
Well, there are, and they're trying to get an antigen test up and running, and I think one may have been recently approved. And these are good if your intention is to do a quick screening to make sure this person doesn't have the virus, for example, of going into a nursing home. And so that's what they're trying to develop and trying to get that spread widely around the United States. When that does, I think it'll be a real game changer as far as getting people back to work and people feeling more safe.
President Trump back on hydroxychloroquine again. I wonder why.
Well, I really don't know. There was a demonstration up in Washington by some, what I'll say, in my opinion, were quasi-doctors, a lot of them into alternative medicine, again promoting hydroxychloroquine. But there have been multiple prospective studies on hydroxychloroquine. And these randomized controlled trials are very, very important. And the latest one was from Brazil. We shipped 2 million doses of hydroxychloroquine down to Brazil. The doctors down there have studied it, and they've come up with, well, it doesn't work. And this was published in New England Journal of Medicine just a few days ago. So it is very frustrating to see this narrative keep popping up again. There are much better alternatives for people to use than hydroxychloroquine. Remdesivir would be much better, for example, if you were in a hospital that does have evidence behind it that it does work. And of course, Eli Lilly is going to be coming on with the antibody serum that they're making in the labs, and hopefully that will be out in a couple of months. And when that comes out, that'll be sort of a bridge to a vaccine. So that'll be really good news. And hopefully by the end of September, we'll have that modality, which I think will be a game changer.
And one other story about face shields, right?
Yes, and this is the one big take-home point, is that the Swiss government has warned their populace regarding wearing face shields. And face shields, as you know, are very comfortable, they're popular, but they had an outbreak at a hotel, And the workers that wore face shields got contaminated. The workers that were wearing masks didn't. And this also relates to whether or not this virusol is airborne or aerosolized. And you wouldn't have had that observation if it was just spread by droplets. So there is a component of aerosolization. That's why we need to wear masks, and it's why you need to social distance. And if you can do both, that's going to be best.
That's what people in the medical community do. They wear both, don't they?
Yes, because neither one's 100%. We've talked
Right.
about trials that show that sometimes droplets can spread greater than 6 feet. Sometimes you could have aerosolization, which means someone talks, you walk through their plume 3 minutes later, and you would still get infected. Well, if you're wearing a face shield, it just goes around the sides. A
I
mask,
see.
even a surgical mask, will give you some protection with that.
Dr. Kevin Kavanaugh, thank you so much for being with us. We'll talk to you again on Friday.
Thank you, Jack. Appreciate it.